title of my speech is Delayed Umbilical Cord Clamping. And the purpose of my speech is to persuade you that delayed umbilical cord clamping should be practiced by all capable hospitals. It should be practiced and it should be offered to you by all hospitals that are capable of doing so. Why? Because your baby deserves a healthy start at delivery. So today we'll be discussing three things. We'll be discussing, first of all, some problems and the need for change regarding delayed cord clamping. We will also talk about a solution to the problem. And then last but not least, we'll talk about the benefits of my proposed solution and the benefits of delayed cord clamping. First, let's begin by discussing some problems and the need for change regarding delayed cord clamping. According to the American College of Obstetrics and Gynecology, only half of the United States hospitals report delayed clamping for most healthy newborns, with variations by hospital location and cesarean birth rate. A change is needed. World Nutrition Journal states that more than half the cases of anemia are due to iron deficiency. Anemia is a major and global public health problem that affects maternal and child mortality, child cognitive development, and eventually productivity. Infancy, adolescence, and pregnancy are all at risk for anemia. A change is needed. And I'll repeat that again. Infants, adolescents, and pregnant women are at risk for anemia. A change is needed. The American Journal of Obstetrics and Gynecology Maternal Fetal Medicine states that anemia during pregnancy is one of the most common diagnoses among pregnant women, given that it is estimated to affect 40% of women worldwide. A change is needed. According to the American Journal of Gynecology, anemia is associated with preterm births. A change is needed. Necrotizing enterocolitis is a devastating pediatric gastrointestinal disorder of preterm infants, according to the Journal of Infectious Disease. A change is needed. Intraventricular hemorrhage, and a common term for that is a brain bleed. Intraventricular hemorrhage or brain bleeding in your baby is the leading cause of mortality and disability in premature neonates, according to the Iranian Journal of Child Neurology. A change is needed. So now that we've discussed some problems in regards to delayed umbilical cord clamping, and the major problem is that only half of the hospitals in the United States are practicing it. So that's the main problem. My solution to the problems just mentioned is a policy mandating all capable hospitals to practice delayed umbilical cord clamping and to have a policy in place for it, along with employee and patient education about it, along with a policy that mandates all obstetricians to discuss it with their patients. According to the American College of Obstetrics and Gynecology, only half of the United States hospitals report delayed cord clamping for most term babies. If only half of the hospitals are doing it, a policy mandating it could help all capable hospitals to get on board with it, just as they have breastfeeding and the promotion of it. So now that we've discussed the solution to the problem, let's discuss the benefits of my proposed policy and delayed cord clamping. So my policy would bring about change, causing all capable hospitals to practice delayed umbilical cord clamping. Delayed umbilical cord clamping plays a big part in helping to decrease anemia, necrotizing enterocolitis, and intraventricular hemorrhage or brain bleeding. All of these things were listed above as problems in my main point. Again, I'll repeat that. Delayed umbilical cord clamping plays a big part in helping to decrease anemia, necrotizing enterocolitis, and intraventricular hemorrhage, which are all problems, particularly in preterm babies. So according to an article published by Multidisciplinary Digital Publishing Institute entitled The Feasibility of Novel Delayed Cord Clamping, delayed umbilical cord clamping for 1 minute or longer following a neonate's birth has now been recommended for preterm and term newborns by multiple professional organizations. Delayed cord clamping has shown to decrease rates of iron deficiency anemia, intraventricular hemorrhage, necrotizing enterocolitis, and blood transfusions. Your baby deserves this great start at delivery, especially your premature baby. In my PowerPoint, I discussed with you some benefits of delayed umbilical cord clamping. For term infants, it decreases the rate of iron deficiency anemia. And for preterm infants, it decreases the rate of necrotizing enterocolitis, as I said, and it also decreases the rate of intraventricular hemorrhage. But it also can decrease the rate of iron deficiency in preterm babies. In my PowerPoint, I also talked about some harmful effects of not practicing delayed umbilical cord clamping, some harmful effects of not practicing it. And as far as hematology is concerned, not practicing delayed cord clamping could decrease your baby's red blood cells, your baby's hematocrit, and your baby's hemoglobin. It can increase hypovolemia and can cause dehydration. As far as body iron stores, it could decrease ferritin in your baby out to 48 months. It could also decrease total body iron in your baby at 6 months. As far as cardiovascular issues are concerned, not practicing delayed cord clamping could decrease adaptation. It could decrease your baby's blood pressure. It could decrease red blood cells it could decrease red blood cell flow, or the flow of red blood cells to your baby's brain by 18%. It could also decrease red blood cell flow to your baby's gut by 15%. And that is what contributes to that necrotizing enterocolitis. As far as your baby's kidneys are concerned, not practicing delayed umbilical cord clamping could decrease blood flow to your baby's kidneys. It could decrease your baby's urine output. It can also increase sodium excretions. Your baby deserves a good start at delivery. So now that we've discussed the benefits of my proposed solution, let's review what we've discussed today. Today we have discussed problems and the need for change regarding delayed cord clamping, a solution to the problem regarding delayed cord clamping, and benefits of my policy and delayed cord clamping. So I hope that I have persuaded you today of the great need for all capable hospitals to practice, to engage in delayed cord clamping and the benefits of it. Please discuss delayed cord clamping with your obstetrician prior to your delivery and include it in your birth plan if you so desire. Thank you.